The development of haploidentical stem cell transplantation or the stem cell transplantation from haploidentical donors is rapidly evolving. The problem is actually you need an HLA-compatible donor, which could be either an HLA-identical sibling, which is around only 30% of the patients. So you should have a brother or sister which is from the same parents, so then the likelihood is 25%. Or if you don't have an HLA-identical sibling, you can look in an unrelated registry. So there are about 30 million people around the world who are willing to donate the stem cells for patients with leukemia, which they don't know actually. But still, because these are mainly patients in the registry from a Caucasian background, ethnic background, so therefore the likelihood for us European is about 80% to find an unrelated donor, while for others in Africa especially, or Black Americans, the likelihood is much less. And therefore, you can use so-called alternative donors. One option is to use cord blood. The other option is to use mismatch unrelated donors. But these are all procedures with more complications. And also haploidentical stem cell transplantation. Haploidentical means, the correct definition is, you share only one haplotype of the HLA, which is actually your kids are haploidentical, your parents are haploidentical, and also probably some sisters and brothers if they are not HLA identical. But also aunts or uncles or nephews can be haploidentical. So in other words, to have an haploidentical donor is very likely for every patient. So it's more than 95% that you have an haploidentical donor. But because there is this HLA disparity, the risk of complications like graft versus host disease or graft rejection is much higher. So in the past they moved a lot of these so-called T cells out of the graft. It was very complicated, associated with more complications. In the more recent years, it was then developed a so-called T cell repleted approach. Either by the Chinese, they use some form of ATG, this is an anti-tumor site globulin, depleting the T cells. Or in the US, it was in Baltimore, and they developed the so-called post-Cy approach. It means they give cyclophosphamide after transplantation on day 3 and 4. And this actually allows to do haploidentical stem cell transplantation without higher risk of graft rejection, without higher risk of GVHD. And it's also quite cheap and convenient, so everybody can do this without having a huge lab to deplete T cells like in GMP labs. So therefore the increase is especially seen in countries with low resources. So in Asia they started with haplo, South America they do a lot of haplos, but also in North America and Europe they do now a lot of haplo using this post-Cy. And interestingly, what is so far available from registry studies or single center retrospective studies, the outcome of so-called haploidentical and at least unrelated donors seems to be comparable. So that's as now running, so we run in Europe now a large study which is comparing randomizing patients with unrelated donors and haploidentical donors, and they will receive the same conditioning regimen and the same GVHD prophylaxis. So this is an exciting development. So haplo is really fashionable today because now everybody of the patients will have a donor.